The real truth behind benign prostatic hyperplasia. Have you ever experienced difficulty starting or maintaining urination or a weak or interrupted urinary stream? Are you over 50 and worried about the possible effects of B.P.H? Are you looking for ways to reduce the symptoms of B.P.H? You're not alone. Find out the real truth behind benign prostatic hyperplasia. Let's get started with the basic. Well, the prostate is a small, walnut-sized organ that surrounds the urethra. As men age, their prostate glands may enlarge, causing obstruction of the urethra. This obstruction makes urination difficult, resulting in frequent trips to the bathroom, a weak urine stream, and difficulty initiating urination. This condition is known as benign prostatic hyperplasia or B.P.H. But what is benign prostatic hyperplasia? Benign prostatic hyperplasia, B.P.H, is a disease that affects men as they age and is characterized by enlargement of the prostate gland. This condition is also known as benign prostatic hypertrophy and is the most common form of benign enlargement of the prostate gland. It is estimated that approximately half of the men in their 50s and up to 90% of men in their 80s have B.P.H. Symptoms? Symptoms of benign prostatic hyperplasia, B.P.H, include difficulty beginning and maintaining urination, a weak or interrupted urinary stream, frequent urination, straining to urinate and an urgent need to urinate. What are the causes of benign prostatic hyperplasia? The cause of B.P.H is not completely known, but age is one of the main risk factors. Other risk factors include smoking, family history of B.P.H, and certain medications. Okay, if you're concerned about this condition, let me tell you. B.P.H is not a serious disease, but it can cause a variety of discomforts and increase the risk of long-term urinary tract problems. How should benign prostatic hyperplasia be treated? The first step in the treatment of B.P.H is lifestyle changes. These include avoiding foods and beverages that act as diuretics and avoiding drugs that can worsen the condition. Some examples of diuretics foods and beverages are celery, watermelon, cucumber, ginger, parsley, green tea, cranberry juice, dandelion tea, apple cider vinegar and lemon water. In addition, exercising regularly, maintaining a healthy weight, and getting enough sleep can help improve symptoms. Drug therapy is usually the next step in the treatment of B.P.H. Alpha blockers are drugs that relax the muscles surrounding the bladder and prostate, making it easier to urinate. 5-alpha reductase inhibitors reduce the prostate size by blocking the production of testosterone, which stimulates the growth of prostate tissue. In severe cases, surgery may be necessary to relieve the symptoms of B.P.H. Transurethral resection of the prostate, TURP, also known as bladder neck incision, is the most common procedure to treat B.P.H. This procedure involves removing part of the enlarged prostate from the bladder neck to reduce the obstruction. In addition to medications and surgery, alternative treatments can also be used to reduce the symptoms of B.P.H. These treatments include herbal supplements, yoga, massage, and acupuncture. Risk factors. Risk factors for B.P.H. include Age, family history, and ethnicity. B.P.H is most common in men over the age of 50 and occurs more often in African American, Native American, and Asian men than in Caucasian men. Having a family history of B.P.H may also increase the risk. Consequences of leaving benign prostatic hyperplasia untreated. If left untreated, B.P.H can lead to long-term urinary tract problems such as bladder stones, urinary incontinence, bladder infections, and kidney damage. Don't let B.P.H prevent you from living your life to the fullest. If you're looking for an effective way to manage your B.P.H symptoms, don't hesitate to seek professional help. Join us for our next video to find out how you can take charge of your B.P.H.